Hi there. Could you please introduce yourself to our viewers?
Yeah, my name is Fackson Mwale. I'm a professor in the Department of Surgery. I'm also the graduate program director in the Surgical and Interventional Science.
Could you describe the different concentrations available in the graduate programs?
So here's a summary of the different concentrations. First, we have got digital health innovation. The focus for digital health innovation is clinical epidemiology, medical artificial intelligence, applied data science, and digital health. And the unique opportunities is that the students gain expertise in specialized health data analysis tools, and they work with digitized health and social data. They are able to develop AI-driven solutions for healthcare applications. And there's also the global surgery option, which focuses on addressing surgical healthcare needs in resource-limited settings. And the unique opportunities are that they are able to conduct research on surgical care and injury surveillance in low and middle income countries. There's also the surgical education option, and the main focus of surgical education is enhancing surgical education through research and curriculum development. And there are unique opportunities such as learning educational theory, curricular design, and implementation specific to surgical education. They can be able to collaborate with medical educators to improve training programs, and also they are able to prepare for leadership roles in surgical education and academic medicine. There's the fourth option is the surgical innovation option, and so the main focus is hands-on innovation in surgical and medical device development. We are able to identify clinical needs and create innovative solutions. And they are able to collaborate with engineers, business professionals, and healthcare providers. And finally, we have the surgical outcomes research option, which focuses on improving post-operative outcomes through data-driven research. And the unique opportunities of this is that the students are able to learn biostatistics, research methodology, and outcome measurement techniques. And the students can be able to conduct data-driven evaluations of surgical interventions, contribute to evidence-based improvements in surgical care, work with hospitals, research institutions. So one of the other things that we have is what we call the core stream, which is the Masters of Science in Surgical and Interventional Sciences. It's the thesis option, which is research-driven program, and it's basically designed to provide hands-on and innovative learning experiences. And this program aims to develop students' expertise in literature review, research methodology, and scientific communication.
What steps should applicants take to ensure they choose the right concentration for their career goals?
Yeah, that's a very good question. Applicants should, first they should reflect on their career goals and interests. What are their long-term career goals? What do they want to become in the end? And so these are research concentration specific topics and career opportunities that they can engage into. One important thing is to try to review the program's curriculum and what are the required skills. So look into the required skills. For example, for AI for digital health, or biostatistics for surgical outcomes. And the other important thing is that you could contact faculty members or program directors for guidance or aligning career aspirations with the program offerings.
Can you outline the application process for potential students?
Yeah, so The application process includes the following steps. Decide if you want to apply. First, you have to decide if you want to apply. Do you want to apply for thesis or non-thesis programs? And from there, if you decide that you're going to go the thesis program, the research-based programs route, you have to identify a supervisor. And to do this, what you do is review faculty profiles to find potential supervisors and obtain a letter of supervision confirming their willingness to supervise your research. So we have a lot of faculty on our website that you can look at, and you can talk to them, and if you are a match, you can ask for supervision. There's the online application on the Slate platform. What you can do is open an application form and you pay the fee through McGill's graduate admissions portal. There's a document submission, so it's important that you submit official transcripts, which include a CV, recommendation letters, and proof of English proficiency, if applicable. Now, for research programs, you can upload a brief research proposal, the letter of supervision, and a signed letter of understanding, all three provided by the supervisor. Now, there are deadlines for opening an application. For the fall intake, it's January 15th for international applicants and April 1st for domestic applicants. For the winter intake, it's July 15th for international applicants and September 1st for domestic applicants. Now, there is also a deadline for documents submission that you should observe. For the fall intake, it's March 15th for international applicants and July 21st for domestic applicants. Now, for the winter intake, it's October 1st for international students and December 1st for domestic students.
How does the graduate program support students in transitioning to professional roles in their chosen concentration area?
Yeah, so before students join the program, we engage with them to understand what are their long-term goals. And throughout their studies, what we do is we provide mentorship and guidance to ensure that their chosen concentration aligns with both their academic background and career aspirations. For those, so sometimes we have got students who are aiming for medical school. We identify them very early. The program enhances their credentials, making them more competitive applicants. We have workshops, internships for students who want to see what the cultures outside academia, and we send them to industry, to pharmaceutical companies, etc. And there's also mentorship from faculty. We also have, for those students who are taking surgical innovation, we have got different lectures from different sectors, from industry, patent, etc.
What types of funding are available for students?
We offer a lot of funding options. So these include the stipends. The stipends provided especially for research-based programs, and so these cover living expenses. And of course, these are contingent on meeting academic and research expectations. There are also competitive scholarships, and these are available through McGill and also external organizations. We have got the assistantship, which are offered based on program-specific needs. And applicants explore funding sources through McGill's graduate funding opportunities page. And they can consult program advisors for guidance, such as Ms. Jan Walker, who has all the details and how they can be able to apply.
Thank you for giving us your time.